Oftentimes patients will come in to have their necks evaluated and they want a neck lift. Everybody wants a neck lift because, strong jaw lines really are considered a very attractive and a very powerful look. Younger patients really do great with, liposuction, and I'm using some tools like Vaser and Renuvion and doing some very, very nice liposuction, lipocontouring, and then skin resurfacing. Oftentimes we will put a chin implant in because the chin brings out that sometimes weak chin, and by adding a little bit of length to that, the entire jawline looks better. The other thing that we'll do is we'll make a small incision behind the ear and put in stitches to pull the muscles back. So this gets tightened and then we pull back this way. And that's great for young patients. So, patients that are 20, 30, 40, that looks really good. By the time you're probably 50, you really do begin to get some facial descent. And those patients are not as good a candidate for isolated neck lifts because this aspect of the face, this mid-face, has begun to fall. And if you go home and sit in the mirror and lift your face, you can see what impact it has on your chin. And so for younger patients who really don't have vertical descent, I think that isolated neck lifts are great. And so an isolated neck lift for me is a small incision in the neck, tighten the muscle, remove fat under the platysma if you need to. Maybe it's a chin implant, and then it's some liposuction with Renuvion, which is skin tightening, and then maybe a little stitch. It sounds like a lot of surgery. Honestly, it's a lot of little steps, and what really can be a very, very good outcome for patients. Recovery is 4 or 5 days. We don't cut out any skin most of the time. The incisions are behind the ear, so nobody sees them. So that's an operation, I think, for young people. It can be very, very satisfying.